I'm a social worker at Hospice of Lenawee. I've been here since 2014, and through my role as a social worker, I meet with patients and families within 72 hours of admission. I complete a psychosocial assessment, including assessing for community supports and services, assessing for financial needs, assessing for complicated grief, and providing education on the dying process. When I meet with the Hospice of Lenawee patient and family, I introduce the social work role and the kind of support I can provide them with. Sometimes these patients and families have had a previous social work experience that may not have been positive. So at this time, it's really an opportunity for me to reassure them that I'm there in a non-judgmental capacity, and I'm there to meet them where they're at. I worked with a patient who had ALS and who also was a veteran. He was well established within the VA healthcare system. So as his social worker, it was part of my job to be in communication with some of his team at the VA hospital. I worked with his family to help coordinate supports and services within his home to make his care easier. And as his disease progressed, he lost the ability to talk. So as his social worker, I became his advocate. During visits, I gave him emotional support because he experienced a lot of depression with some of the changes that he experienced. With that depression, I increased my visits and visited with him weekly. I became a sounding board for him, and I was able to be a safe, trustworthy team member that he felt comfortable expressing some of those emotions to that otherwise he felt like he was burdening his family with. And so with my role as the social worker, along with the other team members through his hospice team, we felt like we were very influential in him remaining in his own home for as long as possible before passing away. I feel that hospice care is important at the end of life because as social workers, we're able to initiate and facilitate some critical conversations with patients and their families. We're able to assist them with expressing their end-of-life wishes and saying the things they want to say to their family and loved ones so that they can have a dignified and peaceful death. I feel that people should call Hospice of Lenawee sooner to receive hospice care because Hospice of Lenawee can offer many layers of support to someone in the journey at the end of their life. I feel like it's important for people to understand that it's not about giving up. It's about having an additional layer of support within Hospice of Lenawee so that they can have the best quality of life and a peaceful, comfortable death. We also, as the social worker, can provide them with education on what Medicaid and Medicare provides. When a patient signs on to Hospice of Lenawee, they may be in the beginning process of their terminal diagnosis, or they may be close to the end of their journey. And the nice thing about the social work support within Hospice of Lenawee is that it's voluntary. My time at Hospice of Lenawee has been rewarding, fulfilling, and has completely changed my personal outlook on death and the dying process. It's made me understand what's important in life, that life is precious, and that anything can change at any moment, to not take things for granted. I love my work at Hospice of Lenawee because it allows me to use my professional and educational skills to provide support to the patients and families. And it is a privilege to be a part of someone's journey at the end of their life. I really want people to understand that it's not about giving up. It's about having an additional layer of support within Hospice of Lenawee so that they can have the best quality of life and a peaceful and comfortable death.